This is the clinical intensive breakdown for the course at my office here in Hamilton, Ontario. This is available to up to 8 practitioners at one time. It is the most clinically intensive course you'll ever take in your life. So what happens is 2 days, Saturday and Sunday. We start off learning the intricacies of XDOR, going over some basics that I use in practice to maximize the clinical performance and the clinical results. Then the live patients come in. This is all live patients. So live patients come in and you'll start by seeing 2 live patients at once. So you'll take 30 minutes with one, 30 minutes with another one, and then that'll lead us into a time management lecture to show you how to manage time here in the clinic, what the keys are and how to utilize those keys. Then we take a short lunch. Then more patients come in, what we call team seeing. So team seeing is you'll pair up in a group of 2, and again, you'll see 2 patients at the same time. This way you'll get one patient started on needles, go into the next one, take a brief history, get them started, and everything's going to be scripted with these patients because they are subsequent visits, but it gets progressively harder as you move forward. Then it's something called setup and explain. Everyone has their own patient coming in. These are live, real patients. You take your history, you do your assessment, you set them up on an acupuncture treatment protocol, and then you explain it to the rest of the class. After the explanation, you perform some soft tissue work, and it goes on, and each person presents in front of the class so we can learn from one another. Then there's a live patient demo. So a live patient comes in, I do the patient demonstration, and what I show you is some streamlines of XDOR that I use, some streamlines of the gait analysis that allows me to spend a little less time on assessment so I can maximize my time on treatment. Then there's some motor point practice. We go over working on one another, serratus anterior, levator scapula, internal oblique, TVA, glute max, QL. Then it's Sunday. Then we have rapid fire motor point stations. We have 8 stations with 8 patients. You spend 10 minutes at each station and you flip the card, you perform those motor points, you skip on to the next, and so on and so forth. Then again, we see 2 patients at the same time. They're all different patients. Then after lunch, you see 3 patients at the same time, utilizing your time management skills, and you'll start one patient, then start the other, then start the third, and go back to the first, do soft tissue, and so on and so forth. Well, 2 people are doing that. The rest of the class is going to be working on each other, upper and lower motor points, until everyone has seen 3 patients at once. Then it's 4 o'clock. So you're thinking, okay, we're going to do some question and answers. You're going to go home. Actually, no. We're going to get 6 more patients coming in. And these patients, you're going to start from top to bottom. That's what it's called, top to bottom. And you're going to do the history. You're going to do the XDOR assessment. You're going to set up the treatment plan. And you're going to do that within 45 minutes. And then you can go home. After this course, your clinical aptitude, your confidence is going to go from here to here. So I hope you enjoy this.